This is Catherine Morgan from Point A to Point B Transitions, and I'm also the founder of the Depression Discussions, the conversations entrepreneurs need to have. Today, I'm very excited to bring you my friend, Catherine Maney. Catherine is someone who I met when I was speaking, and we just immediately had this connection. And offline, we spent some time talking about depression and anxiety and stress and the effect on career transition and entrepreneurship. And I knew I had to bring her on the depression discussions. Catherine has been an RN for 35 years, and I'll let her tell you the rest of her background.
Okay, well, hi, and Catherine, I'm so excited, and meeting you was just such a blessing, as I've shared with you before, because I really needed to have the support and to understand I'm not alone, and you gave me some motivation to really, reach out and go there. And right now I'm in a place where, you know what, maybe I'm just going to work for myself from now on. So that's my story.
Well, not really. You spent some time in academia. You spent some time tutoring nurses on getting certified, correct?
And I did clinical work, because a lot of times when you teach, people say, well, were you ever a real nurse? Yes, I was in the trenches for a long, long time. One of my favorite things, working with veterans. So yes, I have clinical background as well.
So you were kind enough to say that you would share about the brain chemistry of depression and anxiety in a way that we could possibly understand it if we weren't bio majors. But just as we were leading up to this conversation, it's fascinating. Can you talk about the escalation and then how this can spiral?
I can. So what we all know is that when we're faced with a stressor, whether it's something we see we're afraid of. So for me, if I see a snake, my body responds. And one of the things that happens is my body produces a lot of adrenaline, so I can run. My heart beats faster, etc. And all that, my eyes dilate because I got to see, I become hypervigilant. So that's the body's stress response. So whether it's real, I see a snake, or whether it's a perception, OMG, this is a step or a leap out into the unknown, and I am scared, scared, scared. So either way, it doesn't matter. Your body gets it the same, right? So there's a strong link to depression. And one of the things we were talking about before, Catherine, is how the stigma, and especially now that depression is such a common diagnosis, that it's almost people are immune in a way that when somebody says they're depressed, oh, okay, smile, feel better, get more sleep, get a drug, okay, all that stuff. But that's not really, in my experience, really demonstrating some understanding and empathy. And there is the, how come I can't just get myself out? Why can't I just be happy? I'm not
going to power through it. Why can't I control my mindset?
Push hard enough, exactly. And I can think myself. And all my life, I've been strong, I've been capable, and now what is wrong with me? Why can't I? And that is it's so hard. It's hard on us, and it's hard on just our whole psyche. And like you said, Catherine, you talk a lot about headspace. So I want to talk about physical headspace. So we all know we got a brain in our head.
Here's hoping.
Well, I'm thinking pretty sure. If you can walk, talk, and even if you can't, you still have a brain in there. As long as your heart's beating, you got a brain. So the brain is pretty complicated, and and Catherine was saying, okay, I'm going to explain it in a way. You're all smart adults, but the bio piece can be pretty technical. However, middle of the brain, you got some stuff. One thing is the pituitary gland. I'm sure you've heard that word. But y'all have a little spot called the amygdala and the hippocampus. And those things, I think those are getting out in the public more.
The lizard brain, the fight or flight, right?
Yes, and that's where the fight or flight. And when your body is that stress, you got two little, I call them little glands sitting on top of the kidneys. And they are the ones that are stimulated to push out the adrenaline so that you're ready to go. Well, part of the adrenaline push is a release of hormones called cortisol. Now, if you've ever taken like a prednisone, methylprednisone type medication, that's external cortisol. So our bodies produce cortisol, and we have a limited capacity because our adrenal glands are working based on what our perception is and our circadian rhythms, etc. So if you have a sustained stress response, and whatever that is, stressors such as
how about cash flow problems?
money,
Like, I don't know any entrepreneur who's not experienced
right?
instances of cash flow problems.
Yes.
No one, not one.
So cash flow, worry about meeting your expenses, your responsibilities. Sometimes just you're so scheduled in when you're at the beginning, you are just going, 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 and your body responds to that. So with I see the snake goes away, now I feel better, the threat is gone, and my body slows down, that cortisol level drops. When you have persistent stress, that response, that adrenaline, etc., that never shuts off. And what happens if you go back to that brain, that amygdala and that hippocampus, with that never shutting off, all the chemicals in your brain, the neurotransmitters, the levels get all kinds of off. And I know we hear neurotransmitters in the public a lot. Here are the neurotransmitters that are affected with this: glutamate, dopamine, serotonin, norepinephrine. There are like 5 different chemical liquids, if you will, neurotransmitters that are responsible for sending all those signals across the little electric pathways, the neurons. So bottom line is those chemicals now are off because of those continuing cortisol levels. When those chemicals are off, here's what happens. You get changes in your sleep. Usually it's less sleep. You're waking up in the early morning. You get your appetite changes. A lot of times it's a decrease in appetite. Sometimes it's an increase. So your sleep is affected. And now your mood is affected biologically. You just feel sad. You're not motivated. Bottom line is your external stress threats are being read by your body, and now your body is responding. And in addition to psychological symptoms, and the anxiety is part of this, you can also have actual physical pain. So that whole mind-body connection. So when you're feeling that way, and a lot of times, I think this is really important, entrepreneurs, we're often very isolated. We work in terms of we're strong, we're working on ourselves. We do need to network, but you can't always recognize your own body and behavior symptoms. You need people around you to give you that feedback, to say, hey, I haven't heard from you in months. What's happening? We used to go out once every month. Right. Or we used to FaceTime or text, and I have not heard from you. Or your network friends, they call you or they see you. What are you doing? Well, I'm still hanging out in my jammies, and etc. And all those are things that say what's happening. Your gauge can be, how are you functioning? Right. Your basic functioning. So let's say you've been on the couch binge watching for a week and you haven't had a shower or brushed your teeth. Guess what? That's function. One day, awesome. A whole week. So you need other people not only to support you as an entrepreneur, you need other people in your life to help you read the symptoms.
Yes, to mirror. Because you're going to say, oh, I'm fine. I'm fine.
Right. Yeah. It reminds me of the commercial for Med, and the woman who has depression is talking to her doctor, but before that, she has like a mask she's holding up over her face that has a smile on it. And I think a lot of times that's how we feel, because we have to push forward. We have to engage. We have to smile and talk. That takes a lot of energy. That adrenaline, because now we need it for energy. Right. And so you're exhausted. So when you're stressed and you're exhausted, so when we say we're stressed in terms of my schedule, etc., but also think about there's physical stress and changes. So I was looking today at stress relievers because, going to the doctor's office and they say, okay, how about you reduce your stress? Why don't you try meditation or walk or stuff? Okay. And sometimes people hear that and go, huh? I don't have time to sit in a yoga position and meditate. I was looking and I found, have you ever heard of laugh yoga?
I have.
And one of the things that changes that brain chemistry is laughter. So if you haven't heard of laugh yoga, it is an actual bona fide type of yoga. And it does a couple of things. It increases your breathing, so that increases your oxygen to your brain, so your brain works better. Right. And the humor part, it triggers those endorphins, those feel-good chemicals, and they can say to the cortisol, hey, back off, buddy, it's my turn to ride this train.
Right, and if that sounds a little woo-woo to somebody, watch your favorite comedian. Watch them stand up, whatever it takes to get you to have a good belly laugh. I've actually read studies where they say a good solid belly laugh saves you about $25,000 in medical bills down the line.
Right.
Like it's so good for you.
It is. And so the exercise part, and sometimes you hear exercise and again, we're so perfect and we're pushing. So now we got to go to the health club for 45 minutes every day. No, you don't. You can take a walk for 10 minutes, sit in the sun for 20 minutes. That improves your vitamin D. And guess what? The sunshine brings up your mood, as well as now you're producing another part of your body chemistry that you really need. The other thing that I really like is I went to another workshop and we were talking about stress and anxiety. And one of the folks said, well, do something for somebody else, volunteer, etc. And that's awesome. My do something for somebody else is to buy the coffee for the person in the line behind me. My friend was diagnosed with cancer a while back, and it was just a sad day for me. And so my favorite barista, oh my goodness, Linda. So my favorite barista is handing me my coffee. And, I've shared with her, I said, oh, I'm really sad today, my friend. And I said, and you know what? I want you to buy coffee. I'll pay for the coffee. And she said, well, they have a big order. It's whatever. You know what? That is worth a deposit in the hopefully bringing someone else a little bit of wow, and yourself. So just a small thing, and you can volunteer, etc. But that's an immediate, I can do it. And then the day got better.
Yeah, or reach out to a friend that you know is struggling.
Right.
I did that last week. I was really in not a great place last week. I had a lot of stress and some personal stuff going on, and I'm like, okay, reach out to somebody else is the fastest way to feel better. So I knew two friends who were struggling, one with a breakup, one with some health issues, and I was just able to reach out and be there for them.
Yeah, and I think that is also a very helpful thing, because when you're around somebody who's struggling, we communicate to each other non-verbally. So if I'm stressed or I'm whatever, that gets across to you. When I'm with somebody who's struggling, I don't want to project that, because they're already struggling enough. So part of that helps you to reset and just being with other people. The other thing, you have a dog still, yeah?
No, I had to give him back.
So sorry to hear that. But look at your sad face. Pets are very therapeutic. So, okay, you had to give one back. Ours, he hasn't been with us for a long time. He's in heaven barking at the squirrels and probably catching one, right? But even if you go hang out like at a dog park, or you volunteer at a shelter, or even if you open hours, you went and looked for a dog or a cat, just being in the presence. I just love dogs and cats because they are unconditionally accepting you. So if you're feeling like nobody likes me, I'm not worth it, guess what? A pet will.
Yeah.
A pet will accept you for whatever's happening.
Yeah, I was just trying to grab a picture off my bulletin board, but it wouldn't come. I have a borrowed dog. When I need the dog fix, I go up and I visit my parents. They have a 100-pound pit bull, and she's just the sweetest animal on the planet.
Right.
If I need my dog greeting, I'll go there and do the whole fur therapy thing.
And how do you feel afterwards? Because you're smiling a lot.
Amazing. Pets and kids are a really great way to recharge yourself.
Correct. And so all of that works. And now there's another piece that I think is really important, is the medication piece. Because a lot of times folks feel like, I can do it by myself. I'll just do all these non-medicine things. But if you go back to thinking about all those neurotransmitters and all, you have to have some way to balance that out. And if you can tell me how you can make, if you have diabetes, how can you make your pancreas get enough insulin being produced? You can't, right? Well, how can you make your brain make more neurotransmitters and balance them out? If we could, we would, right? And so that's what the meds are for. And I got to tell you, my own issues with anxiety and depression started when I was 29 years old. So now you can guess my age, but it was a long time ago, and there was one med. Prozac had just come out before that. And you know what? Now there are so many good medications. The side effect profiles are very little. And you know what? Who knows the rest of your life or not? But again, back to the diabetes episodes and diagnosis. Are you going to take insulin for a little while and then stop? No, your body needs what it needs. We all have something. And so I would say, should you have that, that recommendation come up from your provider, I would say try it. You can always not. If the med works, it works. And when that cloud lifts or you feel like you're getting out of that black hole, oh my God, what a feeling, right?
Yeah, actually, two interviews jumped to mind from previous depression discussions, conversations. Steve Woodruff and Barry Moltz both talked about the medication being very quickly taking exactly what you just said, this dark cloud that was hanging over them.
Right.
And you know, for them, that was the right decision that had the right consequence. For somebody else, it might not be. And it's a very personal decision, but certainly you should not automatically discount it as an option for you if your healthcare professional thinks that it could be helpful.
Right. So get your ego out of the way and get your shame and guilt and stigma out of the way as best you can. I tell some of my students before they sit for their licensing exam, first thing they have to do is write at the top of the board the most awesome thing about themselves. And if you need to write yourself a note that says, you know what, this is how I feel about it, but it doesn't mean I don't have to try it. And again, it's not going to harm you. Try it, and if it doesn't work. And the other thing I've heard is that a lot of times it takes a few different kinds of trials to get the balance. So think, you've got 5, 6 different neurotransmitters. Too bad we don't have a blood test yet. And so the different meds address the different neurotransmitters. So I would say do try. If you have your conversation with your healthcare provider and you're sitting on the fence, I would go try it, but then make sure there is a follow-up, a phone call. If the provider says, okay, here's your script for antidepressant or anti-anxiety agent, whatever, see you in 3 months, run and get a different provider, because your provider should be saying to you, all right, even if I've had providers say, hey, call me in a couple days and let me know how you are. That doesn't mean the med may start working in a couple days, but what it means is you got somebody who has your back and is watching what's going on. So, and you know what? You get to decide your provider. But if you get a gut sense that it's, straighten up and fly right, it's going to be okay. Yeah, you know what? Maybe, maybe not. But if your body's got that thing going, if you figure out how to control it consciously, please tell me, because then many people would be relieved. But and the reality and the science behind it, no, you can't. So, take care of yourself. You can't. And then just imagine all the awesome things you can do, because now you truly do have the energy and the motivation and the outlook.
That's great. Yeah. It is about sort of managing your mood and how you feel and how you approach your life over the long term.
Yes.
And, situations are going to happen. You're going to lose a client. You're going to have a health diagnosis. A loved one's going to have a health diagnosis. You're going to lose somebody. We're human, and things cycle in and out of our life. Mm-hmm. But navigating these highs and these lows, I hope that we can get people to sort of be going like this rather than like this.
Right. And there's a distinction between a situational depression and a clinical depression.
Thank
So
you.
you have, like,
Yeah.
oh, I beat you to it, huh?
Thank you. Yeah.
So, and you're right, a situational thing, yeah. Are you going to feel sad, depressed, whatever? Sure you are. But if that lasts for a long time, like let's say persists beyond 6 to 8 weeks, you know what? And you start having those other things happening, you know that stress of whatever that situation was, now your body's chemistry is changing.
Right. Yeah. And I've heard a lot of people have gotten some, for that situational, shorter duration,
Right.
I just got the knees knocked out of me type of situation.
Right.
Getting something like a Xanax, it just takes the little edge off, can be super helpful and does not indicate I'm going to need this for the rest of my life, long-term commitment.
And I'm glad you said that. The anti-anxiety agents, I think people get kind of worried about those. The one you just mentioned is very short acting. And just think about it. Go back to that stress response and the anxiety physical response. If you have a medication that helps that, now you can cope a little better in terms of, okay, I can get through it. It's hard. It's the hardest thing. It's going to feel horrible, whatever that situation is, but you're better able to have the perception of, yeah, I can do this one step at a time. I tell my students to chop wood and carry water, man. This is not the time to try and take on, climbing Mount Kilimanjaro. And you just do what you can do to get through that. And the other thing, the people around you, one of the best questions I like to ask, because when you feel so overwhelmed, you're immobilized, you don't know what to do.
Yes.
Somebody says, hey, the last time you had something really ugly and awful, how'd you get through it? And boy, you can come up with a couple of things. And okay, how can you apply those now? And because they worked before, so there's a good chance. And that can just offer that little glimmer in those dark clouds and that deep hole. I've heard both those things as a description. Have you as well?
I have.
So.
Well, thank you so much for talking to me today, Catherine, and for sharing your expertise. This was a joy.
Yeah.
And I look forward to doing it again at some point.
Yeah, thanks for asking me. Enjoy that weather. Boy, that sunshine is great for vitamin D.
It sure is.
All right. Talk to you later.
Bye.
Bye.
Hi, this is Catherine. Thank you for watching this interview of the Depression Discussions, the conversations entrepreneurs need to have. If you want to see more interviews, you can go to depressiondiscussions.com, or please join the conversation on Facebook at Depression Discussions. This is a labor of love for me, bringing this conversation out into the open and out of the closet. My other labor of love is my company, Point A to Point B Transitions, where I help entrepreneurs decide if they want to go into corporate jobs or fix their solo consulting businesses so that they work with clients that they like and make the kind of money they want to make without exhausting themselves and hating their business. If this sounds like you can schedule a 45-minute one-on-one complimentary consultation with me, and I'll help you figure out your right next step. This is Catherine Morgan from Point A to Point B Transitions and the Depression Discussions. Thank you.